Welcome, everyone, to Building Bridges, Strengthening the Educator-Caregiver Relationship. This is the podcast where we discuss the best ways for K-12 educators and caregivers to support children in all aspects of their social, academic, and emotional development. Today, we're talking about speech and language delays in early childhood. A child's first word. It is an anticipated event. It's celebrated when it happens. Sometimes it's even commemorated as family lore. But what about when it doesn't happen? Speech and language delays occur in about 5 to 12% of children ages 2 to 5, according to the National Institutes of Health. And there are different causes for these delays. It can be difficult for caregivers and families to know where to turn or what to do to help their child if they think something is wrong. And as the parent of a child who had a speech delay identified when he was 18 months old, I can personally attest to these challenges. I'm joined today by Patricia Ybarra, a certified speech-language pathologist, and she's also our research director with Pearson Clinical Assessment. Pearson is the world's largest educational company. Today, Patricia's going to walk us through some considerations for educators and caregivers when they suspect that there may be this type of developmental delay taking place. Patricia, thank you so much for joining me today.
Thank you for inviting me. I'm happy to be here and excited to share information on this topic.
Absolutely. No, me too. Like I said, this is near and dear to my heart. So absolutely agree. So let's jump in and let's kind of start with the signs of a speech or a language delay. From your perspective, what are areas that you and your colleagues are commonly treating in young children?
Some areas that fall within the scope of a speech-language pathologist or SLP, I'm just going to use SLP going forward.
Let's do that. Yeah.
Are areas like language. And language is something I'll talk about first because most of the early concerns begin to appear, as you said, when a child isn't speaking or isn't saying very much. And this has to do with language. So language refers to the words that we use to share ideas and get our needs met. And language includes listening, speaking, understanding, reading, and writing. So a child that has difficulty with language may have trouble with one or all of these skills. The next area is speech. And speech is how we say sounds in words. It is typical as children are learning how to speak for them to say some sounds the wrong way. Not all sounds develop at the same time, and some sounds may not be fully developed until 6 or 7 years old. But that doesn't mean that sounds magically appear at that time. So there should be at least some instances where all sounds are being produced much earlier than age 7.
Are there specific milestones in some of those sounds and some of that speech that diagnostic staff or even like educators should be thinking about?
Yes, there are some early indicators for certain sounds. And of course, the sounds that I can talk about are going to apply to English. But for a child learning a different language at home, their sound repertoire or the expectations for their sound repertoire may be a little bit different. One milestone that goes across languages for speech is that at 2 to 3 years old, people who know a child well should be able to understand most of what they say.
Oh, that's really interesting. And that's something I can attest to was not happening with my son. When he was 2 and we had identified that there was a delay, I used to translate for him. I could understand what he was saying, but even other close family members could not. So I've definitely experienced that.
Yes. And SLPs often work with children with hearing loss as well. Some children have hearing loss at birth. Others lose their hearing as they get older. Some children also experience intermittent hearing loss due to frequent ear infections that can also impede speech and language learning during those times. If a child is having speech or language delays between birth and 3 years of age, we want to make sure that their hearing has been checked and get that ruled out as a possible cause for speech and language delays or get their hearing corrected as soon as possible. Stuttering is an area that SLPs also evaluate and treat. And most of us have moments when we pause or repeat a sound or word when we speak. But if this happens a lot, a person may stutter. Some young children stutter while they're learning language, but this behavior should lessen over time. SLPs often evaluate and treat voice disorders and feeding and swallowing difficulties. And I want to provide some resources where you can find more information about all of these areas. Resource that I'd like to provide is the American Speech, Language, and Hearing Association website, also known as ASHA, ASHA. There's a webpage on the early identification of speech, language, swallowing, and hearing disorders on ASHA.org. And there's also the ASHA's developmental milestones, birth to 5 years.
So we know that every child develops differently. Are there certain milestones or flags that people should be aware of?
Yes, there are quite a few milestones in each area, and I'll share a couple of the early milestones. But it's important for me to mention that the expected milestones that I'll be discussing do have a large range, especially for younger children, because the pace at which children develop skills in early childhood is often different for each child and is based on many factors. So not every child who may be lacking these skills will have a definitive delay or disorder. So early milestones in language are that at 7 months to 2 years, a child shows understanding of what others say. At 1 to 1.5 years, a child is able to say a few words. At 1.5 to 2 years old, a child is starting to put 2 words together, like mommy up, give cookie. At 2 years old, a child has 50 words in their vocabulary. At 2 to 3 years old, a child is able to play and talk with other children. And at 2.5 to 3 years old, a child has early literacy skills. That means they like to draw or scribble. They look at books. And for speech, and again, this is for English-speaking children, at 1 to 2 years old, a child who speaks English should be using P, B, M, H, and W the right way most of the time. And at 2 to 3 years old, a child should be using the artsy sound K, G, F, T, D, and N the right way in words most of the time.
This is so interesting for me, just thinking back on my own family's experience. And it was those letter sounds that were the tip-off. I noticed that my son couldn't make the M sound, pressing the lips together, whereas that, this with the tongue against the roof of the mouth or like sounds from the back of the throat that he could do. We'll come back to all that, but this is just interesting for me personally.
Yes, and a lot of the first words that children say, once you know these sound expectations, you can kind of put that together, because a lot of the first words that children say is mama, dada, baby, wawa for water, because those are the sounds that they learn first. So some hearing milestones for hearing are that between 7 months to 1 year, a child should respond when you call their name. At 1 to 2 years, a child should be able to follow simple directions. For stuttering, signs that stuttering may not stop begin at 2.5 to 3 years old. If a child has a lot of trouble saying sounds or words, if they repeat the first sounds of words like ball, or if they stretch out sounds like farm, if they have frequent and strange pauses while talking, these behaviors may need more investigation.
So that leads perfectly into my next question, which is, you're an early childhood educator, preschool teacher, kindergarten teacher, whatever, and you start noticing some of these issues. What is your first step?
The first action I think educators should take is to communicate their observations to the parents. Begin that conversation around what you see and how you see the child respond to situations at school, and if there are similar behaviors at home. You want to determine if the same concerns are shared by family members, and talk about the potential impacts of those behaviors that are being observed at school. Discuss with parents what steps can be taken to involve other support personnel and the process of moving forward with a potential evaluation and why this is important. Another action educators can take is to familiarize themselves with the resources available for diagnostic evaluations. So if you're working in a daycare setting, what are the programs available in your community? What school district pertains to the children in your area? If you're in the schools, who are the diagnostic support professionals, and get to know the special education department in your district. A lot of time, SLPs, school psychologists, occupational therapists, also known as OTs, and physical therapists, PTs, and several other specialists are assigned to multiple schools. And teachers may not be aware that these individuals are part of the resources that can be tapped into when there are concerns in specific developmental areas. And also being familiar with these resources will help to bridge the gap for parents between people who are familiar, like the classroom teacher, and those that are less familiar, like the support personnel.
That is a great point about the network that is out there and becoming familiar with that network. And I want to ask, just kind of pulling on that last point that you just made, do you have any, it sounds funny to say tips or tricks for how diagnostic staff or educators may bring this up with caregivers, or kind of how to start that conversation? Because it can be sensitive.
Yes. And I think starting off on the right foot is really, really important. So hopefully the classroom teacher has taken some information on the caregiver's preferred communication channels. Do they prefer text, emails, written notes, phone calls, etc.? Some parents may not have access or may not have easy access to email, or they may prefer verbal communication rather than written communication due to language or literacy barriers. So in the manner that they prefer, I recommend reaching out for a time when they're available to have an uninterrupted discussion, because this is not a casual topic to bring up during pickup drop-off time as parents are rushing off to get somewhere. And everyone involved in the initial discussion and subsequent discussions should make sure that they're approaching this topic in a very empathetic and positive way. Parents, especially those who are concerned or have some idea that their child is struggling, can perceive these kinds of discussions in a negative way. They may feel that a spotlight is being placed on what their child can't do or isn't doing. So being very positive and offering solutions that will help the child be more successful in the classroom and in other environments as well is critical to showing them that we want to partner with them in this process of figuring out what is best for the child.
If an educator or anyone from diagnostic staff encounters resistance from a caregiver, how do you suggest that they handle that situation?
Yes, as educators, we should be aware and empathetic to the fact that some parents may experience stages of grief when they learn that their child isn't developing in a typical way. In order to process grief, the parents may experience feelings of fear, guilt, anger, depression, or anxiety, and those feelings may be projected on others. So allowing the parents to process their feelings while also making sure to keep conversations focused on the child's well-being is a difficult balance. And the conversation shouldn't be based on what the child isn't doing, but rather what the child needs to be successful in their environment. So things like, we want to make sure that the child can choose the snack that they prefer, or say hi to friends as they come into the classroom. And bringing objective data is also really powerful. So you can say something like, we've been working on getting the child to turn or look when their name is called this week, and the child has been successful in 2 out of 10 attempts, and we'd like to bring this number up to 8 out of 10 attempts. We also want to make sure that caregivers understand that the years from birth to 5 are so critical for language and speech development because the brain is developing so quickly. The earlier speech and language intervention is provided, the better the chance that the child will make improvements quickly. If the parents are just not ready to proceed with an evaluation, just make sure that they know who to contact and provide all the context information if they want to reach out in the future, and make parents aware that evaluations will not be done without their consent, and continue to check in with the family and provide updates on the child's progress at school.
That is wonderful advice. All of that makes a lot of sense. So let's kind of flip that scenario around. Let's say that you are the caregiver and that you think something may be wrong with your child's speech development. And as I had mentioned in my own experience, it really hit home for me when my son was about 18 months old and he had never said the word mama. And it was just kind of one day I thought, he's well over a year old and he's making sounds and has kind of said dada. And that's when I really thought, what's going on here? So in my case, he was so young, he wasn't even in preschool yet. He wasn't in daycare. And so I asked some other moms in my play group at the time, who fortunately were able to point me in the direction of early intervention resources in our community. But not everyone is going to be in that situation. So what do you recommend caregivers do if they start to notice these types of things?
I think the first point of contact for a lot of parents is the child's pediatrician. Most pediatricians have screening questionnaires that they give to parents during or before well-visit checkups. And these questionnaires cover a range of developmental areas, including speech and language. Depending on the responses to these questions and the outcome of the screener tool, the pediatrician may ask some follow-up questions. But regardless of whether the pediatrician initiates the topic, parents should feel free to discuss their concerns at these visits and see if the pediatrician can provide some resources for early childhood intervention programs, also known as ECI. These programs are available for birth to 3 years of age. If your child is 3, you can still bring up concerns to your pediatrician to find out if they know of any resources, and you can also contact your local school district's special education department and contact your local school to speak with an administrator about programs that are available for children 3 and older.
And that brings up a great point. As I mentioned, we worked with an SLP through our county's early intervention program. So the wider community, what questions should educators and caregivers be asking to make sure that they have all that information?
ECI programs are available in every state and territory. The CDC website is one place that lists the programs available in every state. Their role is to identify and evaluate as early as possible those infants and toddlers whose healthy development in areas like cognition, speech language, and motor is compromised, and provide appropriate intervention to improve child and family development. If warranted, they will provide evaluations for children birth to 3. And if the results of those evaluations show a significant delay, they will provide intervention services, often in the home. There's also a lot of state and local programs available through public schools for children 3 and older. So caregivers can reach out to a local school administrator or the district's special education department to find out what programs and resources are available. Most of these programs provide evaluations and interventions in the school setting. So if parents have the results of any screenings, or if they've looked up developmental milestones and feel that their child is not meeting the milestones in the ranges expected, they can bring up those findings when they speak to the evaluation program personnel.
Okay, so let's suppose educators, the evaluation team, SLPs, and any other support staff that you had mentioned, OTs, others, and caregivers, let's say the whole team around a child or children, they've identified what's causing a delay. What are things that the evaluation team can recommend or share with caregivers so that this support can be provided in the school setting and then also at home?
Okay, I have a lot of recommendations, but I do want to say
that's good.
I do want to say that the nature of the delay makes a huge difference in approaches. So as previously discussed, SLPs work with children with speech, language, stuttering, hearing loss, voice disorders, feeding and swallowing issues, and co-occurring medical diagnosis in any imaginable combination. So naturally, each child has a unique set of needs that often requires a tailored approach. Usually, there will be recommendations for appropriate activities to target goals made by the evaluation team, like the one you talked about, especially if interventions are being provided through an ECI agency in the home. They should be working with not just the child, but the family, and the interventions should either incorporate or translate easily so that they are applicable to functional routines in the home. So if that's not happening, parents should ask about how the child's goals can translate to everyday things like getting dressed, mealtime, potty training, or whatever routines are challenging. One thing that I practiced a lot with parents in ECI settings is to narrate everyday settings. A lot of times parents are busy with laundry and cooking, and I totally understand that those things need to get done in lieu of, let's say, playing a game. So my advice is don't do it in silence. Think out loud. because children, even if they don't look like they're paying attention, can soak up that language. So here's an example of what that may look like. You walk into your kitchen and you say, what am I going to make for dinner? Let me go over to the fridge and see what we have. I see chicken. Should I make some chicken today? Let's see what I can make with the chicken. What's in the pantry? I see rice. I see potatoes. Should I make chicken and rice or chicken and potatoes? That is a lot of language that goes on in our brain that we can be sharing with the child. And on average, children need to hear a word at least 500 times before they start using it. And children with delays may need to hear words more than 500 times. So talk throughout the day.
That makes so much sense. Absolutely. I found that repeating things to my son as well, like once he began to actually make some sounds, make some words, that I would just say everything back to him so that he knew someone was understanding and then he was hearing it again.
Yes, that is a great strategy to use as well. It's actually called recasting. And so even if they say a word incorrectly, you might model it back for them in the correct way. And they get that input, but it also validates, like, I heard you and I understood you. So that's a great strategy. I'll also say that spending at least 10 minutes a day of uninterrupted face-to-face interaction with your child makes a huge difference. So think about looking at books or magazines together. Make sure that the subject matter is something that interests the child, if that's dinosaurs or horses or whatever they enjoy. Pointing and labeling the pictures is such a good way to build vocabulary. We don't have to focus too much on reading straight through the text. Just allow the child to explore the book, flip through the pages, go back again and look through each page and just talk about what you see. There are parents who may be intimidated by the idea of book sharing with their child because maybe they don't speak the language or have trouble with reading. So modeling what this interaction can look like in any language and letting parents practice is crucial to getting them to incorporate this routine. If your child is not yet particularly interested in books or magazines, playing a game like taking turns blowing and popping bubbles, simple puzzles, a game of I Spy, just play some fun music and dance and sing together. Those are all activities that encourage interaction and communication and can build language and speech skills. One thing I want to say about games is that a lot of parents think of educational programs on the TV or learning apps, and the American Academy of Pediatrics provides some screen guidelines and considerations for appropriate screen use for children. However, these types of games don't offer the back and forth live interaction that is so rich in fostering speech, language, and social skills. So if you plan to use a screen, I recommend to find ways to still narrate or talk about what your child is watching to fit in more of that person-to-person interaction.
I love that. We could do an entire podcast series on screen time.
Yes, I think so.
So stay tuned, everyone. That's coming up next. But no, I think that is a wonderful, wonderful call out. It makes sense if you think about it.
Exactly. A lot of times kids can maybe learn a lot of vocabulary, but not the appropriate way to use that vocabulary with other people. So it's not just about learning the words, but also how to use those words functionally to communicate.
Makes perfect sense. So let's talk about, these programs or these interventions, these activities are going on. Educators are going to see their kiddos, move on, obviously, after a year, however long. So what can educators do, whether it's an educator who's helped identify a delay or someone further down the line? What can they do to keep these supports in place once a child is no longer in their class?
Usually, children who are receiving intervention services will have an individualized family service plan called an IFSP or an individualized education plan called an IEP. And in those documents, supports are usually detailed and outlined. Parents must always be invited to these meetings and should attend when these documents are put together. If there's something that you feel is essential to add as a support that works well, feel free to bring this up because parents are just as much a part of the team and contributors to these plans as are the professionals working with the child. And these documents travel with the child through providers in the ECA setting, or from school year to school year in the school setting for continuity of services. But the documents do have expiration dates, and that's important as well because sometimes children grow out of needing certain supports or their needs change. So these documents should be updated frequently to reflect those needs. And if they aren't updated frequently enough for the amount of change that is happening with the child, parents and educators are free to call a meeting to discuss the plans sooner than scheduled.
Wonderful idea. And I think that's so important. Oh, Patricia, there is so much to this topic. There's so much more that I know we could cover, but we are coming up on time pretty soon. So before we wrap up, I just want to ask, are there any success stories, anything from your experience that you can share with listeners?
Yes. I mean, I'm so fortunate to have seen a lot of success in my time working with children as an SLP. I've seen children make big advancements in communication by obtaining resources like hearing aids through the school. I've seen children go through the stages of learning to use a picture exchange communication system to learning to use a more sophisticated system, such as an augmentative and alternative communication device, also known as an AAC device, to enhance their verbal communication skills. But more importantly, I want to talk about how we measure success, because a lot of times we see, we have this perfect picture or this idea about what we expect the end goal to be. And that's okay. But we also have to remember that we can't build a castle without stacking each block. And every block is just as important. Children are going to be making so many new advancements, and they're going to be learning so many new skills. And it is important to celebrate all of those successes. It boosts morale, it improves motivation, and it puts things in perspective for everyone involved that good things are happening, even if we haven't reached the finish line.
I love that. I think that is a wonderful, wonderful sentiment to leave our listeners with. And I will also say, listeners, that after working with an SLP for about a year, my son was speaking so much that she joked in our last session that she didn't install an off button. And there hasn't been an off button ever since. So I can, absolutely see where you're coming from, Patricia, that there are so many measures of success, so many good outcomes that can happen when everyone works together, when families, caregivers, educators, SLPs, everyone, that it can be done. And great outcomes for kids are possible and happening every day.
Yes, absolutely. And that reminds me of a child that I worked with in a preschool setting who went from being nonverbal to being able to say yes and no to things, which posed new challenges for his parents when he all of a sudden said no thank you when it was time for bath time. And he had never done that before. And his mother came to me conflicted because on the one hand, she was happy that he was voicing his opinion, but on the other, she needed him to take a bath.
Yeah. No one really, it is very strange to hear no the first time. Having something pushed back on you, you're like, wait a minute, what? But then, what?
Yeah, so totally understandable. So we had to teach our little friend that some things were a choice and some things were not a choice, but he could choose the toy to take into the bath. He could choose his pajamas and things like that. So yes, sometimes unlocking the door to communication can cause some unexpected results, but overall we want every child to have a voice and to share what they're thinking and feeling with others.
I couldn't say it any better myself. What a wonderful sentiment to wrap things up on. And Patricia, thank you so much for being here today. This is, like I said, a topic that's near and dear to my heart, and I really appreciate your insights.
Thank you so much for having me. It's been a pleasure.
And thank you as well to our listeners. We hope that you learned some strategies today. We've mentioned some great resources that will help you connect with caregivers about potential speech and language delays that you may be seeing in your kiddos in your classrooms. And if you'd like to learn more about supporting children during early childhood, you can visit Pearson's Early Childhood Resource Center, which is located at, this is all one word, pearsonassessments.com. And there you can find more resources for addressing speech and language delays. Thank you again so much, and we hope that you'll join us again soon on our next episode of Building Bridges.